Intermountain Healthcare has launched a COVID-19 public service campaign to give the community a behind-the-scenes look at the impacts of surging cases on frontline ICU caregivers. ABC4's medical correspondent Saray Chin talks with two of the heroes.
And then the second you walk through those doors,
people are on a lot of machines and a lot of medications that are supporting their life.
The nurses and caregivers on the front lines at Intermountain Healthcare are sharing their experience of caring for COVID-19 patients since last March in an emotional public service announcement.
I have been a nurse for 25 years, and I've never seen anything like this.
That's Michelle Marshall, a shock trauma ICU nurse at Intermountain Medical Center.
We just want you to know that when you can't visit, that we're there for you, and that's our role, and that's what we love about being nurses, is that we can take care of those who can't take care of themselves.
But around-the-clock care in a pandemic is taking an enormous toll on the life-saving team in the emergency room.
I consider myself to be relatively resilient, and so I thought I would be handling this a little bit better, but even myself, it really it is a grind, and it's just, you work really hard to do the best you can under these situations and circumstances, and it just doesn't seem to let up. And I see that with my staff. They talking to them every single day. You can just see it just chipping away at them.
Sean Talley is a nurse manager over a team of registered nurses in the shock trauma ICU at Intermountain Medical Center. He says the burnout is real.
It feels that we are at those levels of crisis mode.
And so are the number of dwindling beds, which become a constant, agonizing worry.
As these case counts go up and our hospital is full and our floor is full, we do that shuffle where you get someone stabilized and well enough to progress on to the next level of care, and you move them out, and before the room's even clean, you've already got someone slated to come in. That really does make you worried. It scares you.
Am I going to have to move people out in order to make room for other patients? Am I going to have the really sick ones that can't have their family with them? So not only am I their nurse, but I'm their sister, I'm their mother, I'm, everything all those roles of people who can't be there, I get to be that for that person. And it can be really, really hard and stressful, and it's hard to unwind. And I go home, and I love my family so much, and they support me so much, but they don't understand.
Some days you go home and you really just hope that your patient's still there the next day.
It's hard to explain, I think, to someone who has never seen critical illness what it's like without sounding somewhat scary or sounding like we're over-dramatizing the situation. When we're taking care of this large number of patients who are very critically ill, it also means that resources are becoming more scarce to treat other kinds of patients.
Michelle is frustrated with people not following social distancing guidelines, including wearing masks. She says it's a safety measure, just like buckling your babies in the car seat.
I'm not saying that you're going to be the one that's in my hospital, in my ICU bed, but you don't know if that one split second of not having the mask or the car seat is going to be what is going to bring you to me to take care of. So why wouldn't you understand? It makes me so angry. I mean, how many times do we have to get on this camera and tell you that it's real? How many times do we have to tell you to wear a mask? Sorry. Before you realize it's real. It's so frustrating.
Saray Chin, ABC4 News.